Hey folks, it's Beth Wright, and I'm providing you a podcast about Chapter 10 for NUR 136, Unit 3, and we're going to be talking about drug therapy for immunizations. So one of your course assignments for this particular unit is about continuing education for immunizations, and we have a program where you go to, or a website that you go to. It's referred to as the Nursing Initiative Promoting Immunization Training, and they got a little catchy name there, NIPIT. And there are 6 modules to this, so you need to refer to your syllabus and to the course calendar for the dates of when this is due. Now, it takes a little time to go through these continuing education modules, so you need to, get started on that. Don't wait to the last minute because it will take you some time to do it. But, as a nurse, you will find that you're constantly doing continuing education. You have to. You have to do that to stay current with our profession. So anyway, when you go to that website, click on the modules on the left side to begin those, and they'll have a series of education that you have to read through. There'll be some videos, and then you have to take a test. You got to score 80% on those, but you can retake them, and it'll give you a certificate after each module. So you need to save those certificates and then email them to me so that I can then give you your credit. So be sure to review your syllabus about it and your course calendar as far as the due date so you can get the points for this. So let's talk about the immune system because that's what we're dealing with here. And it can be quite complex if you remember in your A&P. But anyway, let's talk about some of the things with this. So we have an antigen that is any substance that activates the immune system or the response. And, antigen is microorganisms. It can be, anything that causes our immune system to kick in. And an example of an antigen is vaccines and immunizations, which kind of sounds crazy, but the way it all works, when that vaccine is given, it is an antigen, and it kicks in that immune system. It's like, hey, I don't recognize you. I better get to work here and start fighting. And so that's how it kind of works. So the immune response and the way the body works is just fascinating. It's complex, but it's also fascinating. So, you have different parts of that immune response where it begins to recognize antigens and it starts defending the body against bacteria, viruses, or any substance that appears foreign or harmful, which is an antigen. And our white blood cells are the ones that come to the rescue, specifically the lymphocytes, and that's part of the T cells and the B cells of the immune system. And we also have antibodies that develop, and they are a spin-off of the B cells, and they're also known as immunoglobulins. Now we have active immunity, which is produced by a person when given an immunization, and that immunity is produced slowly but can last for weeks or for a lifetime depending on the type of vaccine that you're given. And then passive immunity is produced by a person when they are given someone else's antibodies. The immunity is immediate, but it's short-lived, and we'll talk a little bit more in detail about this. The immune system can be normal functioning or not. So when it's not functioning normal, there's three types of things that can happen. We can either have a hypoactive immune system where a person is immunodeficient or immunocompromised. And several things can cause that. It can either be, an inherited type thing, or it can be a disease process that can cause a person to become immunocompromised. And some examples of that would be cancer, because the medicines that we give them definitely makes them, the chemotherapy and radiation definitely makes them immunocompromised. So that's the word you're going to see, immunocompromised. Lots of different diseases and things that can cause that, cancer being one. HIV positive patients, the organ folks that have received organs, organ recipients, they have to take a medicine for a lifetime when they receive an organ that suppresses the immune system. So that automatically makes them immunocompromised. Certain medications, corticosteroids, are considered, immunosuppressants. So lots of different things. Even diabetics can be considered immunocompromised. And you're going to hear that a lot throughout your training here as nurses. We can have a hyperactive immune system, and that's where, the body perceives substance as harmful and induces an allergic response. So, if let's say that you're exposed to poison ivy, it's time of year when that kind of thing happens, your body starts doing, things like, getting whelps, and causes you to itch like crazy. Urticaria is the word for that. So your body is in a hyperactive state when it does that, when it perceives something as harmful, and it induces that allergic reaction. And then we can have an inappropriate active immune system. And this is where the body loses the ability to recognize the self as okay. And it starts attacking itself. So we refer to those as autoimmune illnesses, and that's when your body starts attacking itself. And some examples of illnesses with that would be rheumatoid arthritis, lupus. There's over 100 different autoimmune disorders, and you'll be learning about those. So those are pretty interesting to study about. Now, there's two web links that I posted on Unit 3 that, one is from the medlineplus.gov, which is the NIH, the National Institute of Health, and the other one is from Hartford Education or University. And these are web links that help you understand the immune system. Again, I know you had some of this in anatomy, in your anatomy classes, but this will help you better understand the immune system, because if you can understand what happens in that immune system, then you can understand why we do certain treatments for that. So a good understanding of that will help you in the future when we study this system more in depth. So immunizations are involved in administering the antigens to induce the immune system to produce antibodies to fight against it. So we have the active immunity, or we have the passive immunity, and that is where serum is given serum from immune people are given to people who are exposed to specific illnesses. So the active immunity is where we give the antigen, like your vaccines or your immunizations, and then the serum from immune people are the passive immunity. So kind of getting those straight in your head. And of course these are regulated by the FDA and that kind of thing. So I got a question for you. Which of the following defines antigens? So are antigens lymphocytes? Or are they macrophages? Or are they considered harmless? No, those are not correct. So the correct answer is C. They are microorganisms that causes infectious diseases, or they can be viruses, that kind of thing. So we got to think about the antigen as what it is. So further discussing active immunity, so we have those biological products that have been developed, and the vaccines are suspensions of microbes. They're either killed microbes or attenuated antigenic products. So attenuated means that it's a live or active microorganism, but it's weakened or reduced in its virulence, meaning its its ability to cause issues. So these are intended to induce those antibody formations for the prevention of disease. And I think that's just so cool how they came up with that years and years and years ago. Many of them produce long-lasting immunity, which is great. And there is a small risk of developing disease with the live vaccines. Now, we have to be careful about administering live vaccines with immunocompromised because they can get the actual illness. So we got to be careful with that, given those. Examples of live vaccines could be the MMR or the flu mist, intranasal flu vaccine. So those are examples of that. So we got to be really, really, really careful about giving those to immunocompromised patients. We want to avoid that. We don't want them developing the disease. And then we have our toxoids. Those are bacterial toxins made to destroy toxicity but retain that antigenic product or properties there. So some of these are made with other components to help keep that antigen properties going, and it promotes better antibody formation and thus better protection. So in your book it talks about those products are like aluminum and calcium phosphate. So these have got to be given IM, intramuscular injection, because of those extra properties that's in there. Now, toxoids are not permanent. So, for instance, your tetanus shot, it will last 10 years, and then you got to have a booster after that. So you got to keep having ever so often, boosters, we refer to that, to help maintain that that protection. And it gives you, your examples. The diphtheria, tetanus, pertussis is referred to as your DTaP, and diphtheria and tetanus is your DT, and then tetanus toxoid. Your passive immunity agents are immune serums, and they act rapidly, but they only provide, a certain amount of immunity there from 1 to 3 months. Now, this literally comes from serum of individuals who are immune. So that's how they're made. And so this is very expensive treatment, very expensive treatment. But the whole goal therapy is to prevent or modify the disease process. So we refer to those as immunoglobulin products. And again, it's made from serum, and it's with high concentration of the antibody Ig. And it's used for cytomegalovirus. That is a common virus that can infect anybody, but most people don't know that they even have it. It's because it rarely causes symptoms. But if a person is immunocompromised or pregnant, then that's where we're most concerned, because they can pick up absolutely weird and crazy illnesses and fungal infections, viruses, that kind of thing. So it is a cytomegalovirus is one of the herpes virus, and it includes the herpes simplex virus, the varicella zoster, and Epstein-Barr virus. You might have heard of that before. Once it's in a person's body, once a person's been infected with it, it stays there for life. But again, most people don't know that they have it. But folks that are immunocompromised, they definitely may have some serious issues with that, and it spreads through the body fluids such as the blood and saliva and urine and serum and breast milk. So it can, definitely be problematic for pregnancy and for immunocompromised people. But hepatitis B, also there's immunoglobulins for that, for rabies, rubella, tetanus, varicella zoster, the shingles, and the RSV, which is a respiratory disorder that affects children, mostly. Okay, got a question for you. Active immunity is produced using vaccines and toxoids. True or false? So hopefully you've answered true, and that is how we get active immunity. And vaccines are suspensions of microbes that have been used to induce antibody formation while preventing causing mild forms of a specific disease. And toxoids are products modified to destroy toxicity while retaining antigenic properties. And remember, they are not permanent. They are the ones that need boosters. Okay, so routine immunizations for children includes the diphtheria, the Hib or the Haemophilus influenza B, hepatitis A and B, the influenza. We got the MMR, the measles, mumps, rubella. We got pertussis. We got polio, the rotavirus, tetanus, varicella, and pneumococcal. So these are your typical ones for children. And then we have adolescents and adults. So we have diphtheria, tetanus, pertussis, hepatitis A and B if not done during childhood. Rubella is something that's done with pre-pubertal girls and women of childbearing ages. The HPV, human papillovirus, is a type of herpes virus, and this is given to both male and females of adolescent age. And then we have meningitis, especially in college-age children. And then, of course, influenza. Now, I've got a pictogram for you, and it shows you the different ones through the age groups there of what is going to be required. And it goes all the way up to your adulthood as well. So the pictograms are great. Sometimes they're not exactly go accordingly to your textbook. Excuse me, but they do provide a good picture. And the excuse me, the old saying, "A picture's worth 1,000 words," can be beneficial there. Now, older adults, we recommend that they get influenza, pneumococcal, tetanus, and varicella vaccine. And again, immunosuppressed patients, we have to individualize their care based on where they're at in their illness or their treatment. Specifically, cancer patients, we've got to be really, really careful with that. If a cancer patient is going to begin chemo, they can receive vaccines at least but they got to do it at least 2 weeks before chemo is what the recommendation states, or 3 months after they finish their chemotherapy. Again, those corticosteroids, which we use a lot for different disorders, that weakens the immune system. So, there are specific guidelines for that as well when giving immunizations. And HIV patients, again, all of those patients are considered immunosuppressed, so we got to watch about that. Again, diabetes, folks with chronic pulmonary, renal, or liver issues, patients with splenectomies who've had to have their spleen removed, their immune system is compromised. Again, organ transplant patients. So all of these we have to consider about vaccinations and do that individualized and avoid live vaccines. That's going to be our key for them for sure. Adverse effects is page 173. So want to look at those mild reactions that can be experienced, especially injection site soreness and erythema, which is redness, fever, and muscle aches. Severe reactions can also occur. Anaphylaxis, which is your severe immune response being hyperactive, and anaphylaxis can lead to death if it's not addressed, if we don't turn that immune system around. So anaphylaxis, it talks about, when you give immunizations, that the patients should stay with you for a little bit to make sure that they're not going to have a major reaction. And we've got to have specific equipment and medications available to treat anaphylaxis when given immunizations or anything that we suspect that's going to happen. Also, serum sickness can occur as well. So teaching needs to occur when we're working with patients and giving vaccinations, so we can teach them about caring for the adverse effects, how to take care of those adverse effects. Contraindications: we don't want to give immunizations if the patient's got a high fever. or during immunosuppressive therapy, or immunodeficient states, and certain cancers, or generalized malignancies of cancer, and then also pregnancy is avoided as well. So I got a question for you. Vaccines and toxoids are usually contraindicated during febrile illness, and hopefully you said true. So we should be giving vaccines and toxoids to healthy individuals, not sick individuals. Okay, so our nursing process, which you've learned a little bit about. Our assessment's going to involve, first checking about allergies and what is their immune condition. Are they healthy? Do they, what's their past medical history and current medical history? Have they had cancer, HIV positive? Are they, things like that are going to have to be looked at. And of course, we're going to have to do vital signs. Those vital signs are going to include temperature, blood pressure, pulse, and respiration. So we're going to do vital signs on those individuals. Our analysis or nursing diagnosis is going to be that the health maintenance. Anybody getting vaccinations, they're trying to maintain their health, so they're going to have health maintenance. And because we're given medicines, we're going to always have a risk for injury related to those adverse effects or side effects. And our goals for this is going to be prevention of illness, and that we don't have any side effects, or we manage those side effects if we do. Our interventions. Now, you always want to pay attention to your QSIN alerts. QSIN is Quality, Safety, Education for Nurses. And so always pay attention. Your book is really good about indenting those or having italicized writing with those. So always pay attention to your QSIN alerts. So especially with these medicines, we've got to check the expiration date on the medicine. The vial that it'll come in will give an expiration date. And there are specific storage requirements for those vaccinations. We typically give these IM injection. So, of course, the proper procedure for that, the proper equipment and supplies in giving an IM injection. We've got to monitor for allergic reaction, so we have the patient wait 30 minutes, and we have to have that epinephrine available. That's what we use for anaphylaxis. We want to monitor the response and the injection site. It talks about in your book induration. That means hardening at the site, like when you have your TB test to check for TB. That's not a vaccination or immunization, but that's a test that's done to check for illnesses. And you all know about that you will know about it because you have to have that. And so induration means the hardening at the site. Teaching, we're going to use the vaccination information sheets for vaccinations, and we always have to report serious side effects. Also, documentation of vaccinations. You have to put the lot number down and where you gave your injection and the date and time, of course, and that is so that we can always monitor if there's any issues with that lot of medication. So each vial of medication will have a lot number, and these are tracked in the event that something comes up with that particular type of medication. So you always have to document specific things when you give immunizations. And then, of course, evaluation. We're going to evaluate to make sure that the client did not have any injuries, or that they didn't get the virus or whatever the vaccine is we're giving them, and that they didn't have any adverse effects or side effects, or if they did, that they managed them okay. So again, we want to prevent interactions for individuals with those interventions, and immunosuppressed patients, again, anybody who, like HIV patients who receive antivirals, those make them immunocompromised. Our organ transplant patients, our cancer patients, all of those patients that we talked about. And you may have heard of the medicine interferon. If they receive interferon, that too can suppress the immune system, so they need to be careful about that. Also, with managing the adverse effects, it's recommended that we do not give pediatric patients up to age 18, even at 18, not to use for fever or aches and pains after getting an immunization, not to give aspirin products. And this is related to the Reye syndrome. That is a neurological disorder that can affect the brain and the liver. That's very serious. So we want to teach parents not to give aspirin for evaluating that kind of thing. Okay, so immunization recommendations. It changes periodically, and so we got to stay up to date when we're administering those. This is something that you may get the opportunity to give when you're in your first semester of clinicals. We've been given an opportunity many times to do that because they do give immunizations in our clinical settings. So you may actually get an opportunity to do that. And so it's important that we stay up to date with that, with those immunizations. Anything you're giving to a patient, you always want to stay up to date. The other thing that I meant to mention earlier, but I didn't, there are specific tests. If a patient has gotten an immunization in the past, there are specific tests that can be done to make sure that the patient's immune response did act as it should, and we refer to that as a titer. And it's an antibody titer, and that's a lab test that measures, where they have to take a blood sample, and it measures the level of antibodies. And so the antibody level in the blood tells your doctor whether or not you have been exposed to an antigen or something that the body thinks is foreign, and or if you received a vaccine in the past, did it work? Is it still there? So those antibodies let us know that you are sufficient in your coverage, in your protection there. And so you may hear that, and you may see lab results of that, and you need to know what it's about. Okay, some best sources for information. The CDC is where we go to all the time, the Center of Disease Control and Prevention. Also, your American Academy of Pediatrics and Family Practitioners is also a great place to go to, as well as your local health department. Those are excellent resources to help you know additional information about the illnesses that we're talking about here, as well as the vaccination. Okay, that concludes your podcast.